some questions, so let's get to it. We have a client. A client was admitted with a diagnosis of acute diverticulitis. Which of the following the nurse should expect and implement in the plan of care? You guys know how I do my SATA question. So for the SATA, you start with the ask. What is being asked? The last statement of the question, the case, reading the rest of the question, find the buzzwords, then rewrite the buzzwords into a sentence. And when you rewrite, check your content, go to the questions, use your rewrite, make a choice, and then you move on. Don't compare any answer. Just use your rewrite and your content and answer it. So we have a SATA. Which of the following the nurse should expect? So I need expected finding and implementing something in the plan of care. Then what is the case? A client was admitted with a diagnosis of acute diverticulitis. So we have diagnosis of acute diverticulitis. I need an expected finding and I need implementation. Those are my buzzwords. So to rewrite patient with acute diverticulitis, I need to find something that is associated with the diagnosis and then implement my plan of care. Then you say, do your content first before you look at the answer. So diverticulitis is on the left lower quadrant, and that is where the sigma is located. It's an itis, so it's an infection. Every time you have infection in your GI tract, everything slows down. So, and you don't want to eat. So most of the time, you are NPO. If you are NPO, I have to give you some fluid. Because this is an itis, patient get antibiotic. Because it's an itis, it causes pain. So you get pain medication. Then, because it's an itis, there's inflammation in the colon. Okay, this is the colon. There's itis here, so there's inflammation. Any pressure in the GI tract will cause this perforation. They are already perforated with diverticulitis, small perforation. That's why they have inflammation. If you put pressure there, there will be more perforation and there will be a lot of stool leaking. So you want to prevent anything that will increase intra-abdominal pressure or in the GI tract. So whatever is going to cause the bowel pressure to increase, you avoid it. So I'm taking this information with me and then analyzing each question, not comparing, and then picking an answer, then move on. Regular diet, negative. NPO, that's the thing. Normal saline at 100 cc. Well, we give him fluid, so this is good. Pain medication as needed. Patient has itis, inflammation, yeah, pain. Enema once a day. No, we cannot do any enema. Enema will increase intra-abdominal pressure, and that will cause more pressure and perforation. IV metronidazole. Metronidazole is an antibiotic, and that's the treatment of diverticulitis. You have to add another medication, ciprofloxacin, and they usually have 2 medications for 7 days. So this is good, antibiotic. A bowel prep for colonoscopy. No, bowel prep is going to increase intra-abdominal and colonic pressure, and that will cause this perforation. So no. So the answers are 2, 3, and 5. And you see, I never compare anything. I find my ask, the case, my buzzwords, I rewrite with my content, make a choice, and then move on as I go down. And then check and make sure what you want is what you've selected, and never look back. This is how you answer SATA. That is the secret sauce for answering SATA questions. So let's try another one. This looked like a prioritization question. 4 clients present to the emergency room, okay? Which client should be seen first? So the same thing. You look and analyze the question, seen first, and 4 clients. So this is a prioritization question, and you have to be sharp. You don't have to be expected, okay? So A client with acute diverticulitis will report left lower quadrant pain. Whenever they give you location, just be careful and make sure it's consistent with the disease. This is your right side. This is your left. So left lower is here. And what is here? Sigmoid. And that is where you have diverticulitis. So look at what they're telling you. The diagnosis doesn't matter. You can have heart failure. It doesn't matter. Don't get scared with the initial diagnosis. Look at the subsequent thing they're giving you, the subsequent information after the diagnosis. You have acute diverticulitis. Okay, fine. You report what? Left lower quadrant pain. There is no shock. There is no sepsis. I'm not worried about that patient. So I'm not seeing you. You just have pain. This pain is not going to cause your lung. It's not going to cause your life and high side because there's no evidence of shock. It's just pain. So I'm not seeing you. I will see you. You are a priority because you came into the emergency room, but I'm looking for the first person I need to see first. A client with acute appendicitis with a white count of 12,000. So where's the appendix? Appendix is here. And you have inflammation, hiatus. I expect the white count to go up. It can be 200, it can be 250. It's an infection. I'm not going to worry about it. If you have infection, you should have a white count. You have to be sharp. Even though white count infection is associated with the sepsis, well, you have to meet certain criteria to be septic. Your temperature has to go up, your heart rate has to have signs, and your blood pressure. None of this was given to me. All they told me is white count is up. I expect that with hiatus, appendicitis. So this patient, we can see them first. No. A client with acute pancreatitis with shortness of breath. Well, you have an infection. It's a form of infection, but mostly inflammation. And I expect some kind of inflammation. But now you have shortness of breath. Well, that's in my B sharp, breathing issue. Why is this happening? Your diaphragm is here. And the pancreas is right here in the left upper quadrant. And then when it get inflamed, it affects the diaphragm. But then, because of the pancreatitis, they need a lot of fluid. So this patient may get like 300 cc of IV fluid. And this can push them into ARDS. Or they can get effusion from the inflammation of the diaphragm by the pancreas. So shortness of breath in pancreatitis is worrisome. It's a B sharp, a breathing problem. I got to worry about it. This is why B sharp is a versatile tool to analyze any questions, no matter what. A client with acute cholecystitis, we got to check our last one and make sure we don't have anything that will make B not that great. So you're looking for other things too. Cholecystitis with right upper quadrant pain radiating to the right shoulder. This is right upper quadrant. This is where the gallbladder. If you have inflammation here, it will go to your right shoulder. This is an expected finding. So 3 is the right answer if you are being sharp. If you are not being sharp, you choose other thing. As an entry-level nurse, you got to be sharp. You don't have to be an expert, just being sharp to find out something that is not right. A pancreatitis patient shouldn't have shortness of breath. You've done them something that you need to worry about them. So that patient, I'm seeing you first. And then finally, another question, SATA question, the same thing. Which prescription the nurse should anticipate? Okay, so that is the what is being asked. A client present to the ED emergency room with acute appendicitis. So that's the case. You have appendicitis. What prescription I should expect as a nurse? So then your buzzwords, you've taken them already. You rewrite appendicitis, prescription I should worry about, and then what I should anticipate. Okay, where is appendicitis? Well, appendix is on the right lower quadrant. And it's an hiatus. So I should expect some antibiotic. I should expect some white count to go up. So this is basically a content level they want you to use to answer this question. Because it's an infection, if you have a fever, these are signs and symptoms. If you have white count because it's an inflammation, I need to give them antibiotic because of the inflammation. Because of the inflammation, the bowel is going to slow down, so patient will not want to eat anything. So they will be NPO. If they are NPO, I need to give them IV fluid, okay? And because they have inflammation, I need to give them pain medication. Look at what I've done. I've given you all necessary SATA they can ask you. Signs and symptoms, infection, content level, treatment. Then you use the signs and symptoms, and we've done treatment too. There's treatment here. And then you can answer that 6 things over there can answer signs and symptoms, content level, and then basically expected finding, basically. And so let's take our information and bring it. Move this car here and then bring it here. Antibiotic, yes. NPO, yes. MRCP, I never said anything about MRCP. You use this for gallbladder, cholecystitis, if you worry about stone. So I never said anything about it. IV fluid, yes. Pain medication, yes. Cold pack on the right lower quadrant. Yeah, this is tricky. They have pain, so why don't we put some cold pack here? Guess what? The pain they're having is peritonitis, basically involve the peritoneal lining. Anything on the skin will not change it. There's inflammation inside the appendix that has caused this tension and it's inflaming and the peritoneal layer, and that's why they have pain. So anything on your skin is not a somatic pain. It's not going to help with that. So this will not. It sounds good. Let's put some high sparks over there. No, negative. This will not help. So 1, 2, 4, 5. And that is how you answer such a question. You don't be afraid of it. Just find your acts, your case, your pathways, rewrite it, make a choice. After you rewrite it, get your content with you and take it and carry it. Your toolbox. That's your toolbox. And then you go. And then you said, well, I'm evaluating you based on what I have. And if I don't see anything, anything that doesn't follow what I know is going to happen, no. Remember, this may be a risk factor question. It may be signs and symptoms, sometimes teaching, sometimes education. And that is all what it's about. So, as you can see, a straightforward question if you follow that protocol. Take care of yourself, keep charging, and subscribe to the channel so that you can have up-to-date videos while you go ahead and study. All the best of luck. Keep charging.